So, we have a few disclaimers. We're going to pretend like these are closed-toed shoes. We're also going to pretend like those are closed-toed shoes, the patient's shoes. There's that, as well as me washing my hands, me sterilizing my equipment. Yeah, okay, cool. I'm also outside of the room currently, so first. Do not laugh. All of this is gonna be on camera, and my teacher's gonna be watching you. You gotta keep it together. All right. Hi, George.
Hello.
My name is Brittany. I'm going to be your student physical therapist assistant today. How are you?
I'm good.
Doing well. Wonderful. It says that you are presenting with right wrist pain from a recent fall. Can you tell me about the fall?
I was walking my dog, and then my dog separated from the chain, and I fell trying to chase him.
Okay.
And I landed on my right wrist.
On your right wrist, thank you. Okay. And when did that happen?
2 weeks ago.
2 weeks, okay. Got it. Okay. Can you show me where the pain is? Got it on your right wrist. Okay. And let's see. How it's been hurting since the fall for about 2 weeks?
Yes.
Okay. And if you had to describe the pain, is it dull? Is it sharp? Does it feel like it's aching?
It's like a moderate ache.
A moderate ache.
Yes.
Okay.
Not aggressive, but moderate.
Okay. On a scale of 0 to 10, 0 being no pain, 10 being you need to go to the ER, what would you rate it?
5.
5 out of 10. Got it. Okay. Are there any activities that you usually do that you feel like you can't do anymore because of pain? Walking your dog, maybe?
Walking my dog.
Okay.
I can't walk my dog. I only have to use my left hand.
Got it. And is your right hand your dominant hand?
Yes, it is.
Okay. Anything else?
Just wanted to feel better.
Okay. Got it. Is there anything that you've done that makes it feel better?
Advil.
Okay.
Ibuprofen.
Okay. And anything that makes it feel worse?
Not taking Advil.
Not taking pain. So pain management is
Yeah.
okay. And says, got it. Okay. Do you have a history of osteoarthritis?
No.
Got it. Diabetes?
No.
Any recent surgeries at all?
No.
And then are you currently taking any medications outside of Advil and
No.
Tylenol? Okay. Okay. So today what we're going to be doing is taking some measurements of your range of motion, seeing basically how much movement you have in your joints for your wrist and your shoulder, and your elbow as well. And then we will also be doing some muscle testing and just seeing kind of where you're at. Okay?
Okay.
Do you have any questions?
None right now.
Okay, wonderful. Is it okay if I assess you by touch?
Sure, that's fine.
Okay, thank you so much. Got it. All right, so what I'm gonna have you do is first we will do some palpation. So I'm gonna have you come this way actually, and you can sit on the edge of the bed here, and we'll put your shoes on, and we'll do some palpating. I wouldn't put too much pressure on that right wrist since you're having so much pain.
Okay. Maybe that's how I got it.
Yeah, maybe that may be it. All right.
I have my closed-toe shoes on.
Yeah, you have your closed-toe shoes on. Thank you. So first, your right vesical groove. So that is going to be here on your humerus. Checking to see if that is intact. Feel any pain? No, not at all.
No.
Never.
Well, if you, yeah.
No,
that
no.
hard,
Thank
yeah.
you. Okay, got it. And then left medial malleoli. So we're gonna go in on this side, checking this. I'm sorry. What?
But the camera can't see this.
Yeah, it can. Yeah, it's wide. It's a wide angle. Got it. Let's see. Perfect. Do you feel any pain here?
Mm-mm.
Okay. And then your right second digit. So I'm gonna put it here. Do you feel any pain?
Mm-mm.
No?
No.
Okay. Wonderful. So now we're gonna take some measurements, okay?
Okay.
You can go ahead and I'll have you lay on your back. You can have the pillow underneath your head.
Okay.
Go ahead and take your shoes off. I can help you here with that. Okay. Okay.
Just
And we
don't.
can help you. There we go. Perfect. Now have you come this way just a little bit.
It's comfortable.
Yeah, you can right down here. Just shift this way just a little bit. Okay, perfect. Thank you. You can relax your hand now. It's not broken. Okay. So first, we're going to do right shoulder extension. So, actually we're gonna do external rotation. Since I have you on your back. Okay, so I'm gonna have you do actually, so you're gonna plant your feet down onto the bed. So plant your feet down, like bend your knee. Perfect, both knees. And then you're going to lift your hips up and shift your weight this way. Yeah, and do it one more time. Scoot, scoot, scoot. Awesome. Perfect. You can relax here. We can scoot the pillow over just a little bit. Right side, we have, perfect. This is your right side.
Yes.
So what you're gonna have to do is you're gonna have your elbow bent just like this at a nice little 90-degree angle. Bend it at a 90-degree, nice. And you're gonna take your arm back and just let it relax here, okay?
Okay.
So you can hold it up right here until we get there. Perfect. So we're going to place, cool. So we're gonna place the goniometer. The fulcrum is gonna be on the olecranon process at the elbow. The stationary arm is going to be parallel to the floor, and the moving arm is going to be on the ulnar side of the forearm. So we're here, and you're going to go ahead and just release that arm back into your nice bend here. Nice as far as you can go without moving your shoulders. As far as you can go.
Yes, ma'am.
Awesome. Got it. And then I'm going to apply a little bit of pressure, okay?
Okay.
Got it. Okay, you can relax. Was that painful?
At the end.
At the end, just extra pressure was a little painful?
Yes.
Okay. With moderate pain, you would say?
Mm-hmm.
Okay.
It's consistent with the first.
Okay. Awesome. And next, I'm gonna have you go laying prone, so you can relax. Relax your legs down. And I'll have you roll. You can roll towards me, and then you'll flip to your stomach. There we go.
So not a 360.
Not a 360. That's perfect. Awesome. Thank you so much. And we're gonna do some right shoulder extensions. So you can release your arms down by your sides onto the bed. Great. You need to scoot over a little bit. Yeah, go for it. Very good. And your arms just down by your side with your palm facing down.
Palm facing down.
Yeah, palm facing down. You can just relax here. as much as you can. Alright, so I'm gonna sit here for a second. So we have for shoulder extension, we have the patient prone. The fulcrum is gonna be on the greater tubercle of the humerus. The stationary arm will be along the lateral aspect of the right trunk. And then I'm gonna have you go ahead and you're gonna lift your arm up, keeping your shoulder down as much as possible. And you're gonna go ahead and lift that arm up as high as you can. Awesome. Can you go any higher? That's about it? Awesome. Okay. Let's see where you're at here. Got it? And then I'm gonna go ahead and push this up just a little bit. Okay, go ahead and relax. Awesome. Thank you so much. You alright? Okay, great. So for elbow or shoulder external rotation, the norm is 90 and our patient was at 95. And for external rotation, the norm is 60 and the patient is at about 60 or 72. So you have a little bit of extra movement in there. And you don't feel any pain doing that, correct? Okay. Got it. Awesome. So now the patient is supine and we're going to measure elbow extension on the left side. So I'm gonna place this little towel underneath your left elbow here. And then you're just gonna let your arm go straight. You can have your palm facing up. And just try to relax your arm. Cool. So the fulcrum is on the lateral epicondyle of the humerus. The stationary arm is on the lateral aspect of the humerus, and the moving arm is on the radial aspect of the forearm. Got it. Cool. And I'm gonna just apply a little bit of overpressure, okay? Does that feel okay?
Mm-hmm.
Okay, awesome. Okay, you can relax. Thank you. And with overpressure, you're about like 83. With passive range of motion. Perfect. All right, so now I will have you sit up. I can help you slowly. Come on up.
Whoa. Unless it's my 50s.
Pull it back and then you can put your shoes on.
Shoes are on.
Shoes are on. Closed-toed shoes are on.
Yes. The Gucci's.
And then we're gonna do your. I'm gonna have you actually, for the sake of continuity, you're gonna come this way on the physical therapy table, and we're gonna do your left pronation. So, you okay?
Yes.
Okay. Alright, cool. So you can place your arm on here and you'll have your thumb pointing upward so your arm is nice and relaxed. Is your shoulder comfortable?
Yes.
Okay, great. So, for your pronation, we will have the fulcrum on the ulnar styloid process. The stationary arm will be parallel to the floor. Here. And then the moving arm will go across the anterior aspect of the forearm. So you're gonna go ahead and just take your thumb and turn it down, turn your palm down towards the ground. Yeah. Awesome. Can you go any more? Okay, cool. Okay, then go ahead and relax. So the norm for that pronation is about 80, and you are at about, I'll say about 83. So a little bit of extra. Got it. And our last one, our last two, will be wrist flexion and wrist radial deviation. Awesome. So, let's see. Okay. So we're gonna bring this back to the side, and I'm gonna have you send your legs that way.
Okay.
So we can do the right arm.
All right.
Perfect. And you can place your elbow in here once again for your right side. So we'll do radial deviation first. So the fulcrum, you can place your arm down this way. Your radius is on this aspect. So we're going to do, actually have your palm up. Palm facing. Is that okay?
Yeah.
We'll do palm down because it looks like you have a little bit of limitation in your shoulder. I don't want to make that difficult. So the fulcrum will be on the capitate. The stationary arm will be along we'll do the anterior surface of the forearm, and the moving arm will be aligned with the third digit. So I'm going to have you go ahead and just take your wrist inward without flexing anything else. Awesome. Can you go any more? Okay, no worries. I'm going to apply a little bit of overpressure, okay? Okay, good. Thank you. So the norm for radial deviation is 20. Our patient is about 18 with overpressure. Got it. And then we'll do wrist flexion. So you'll have your palm facing upward. Actually, we'll do your palm facing downward. And you're just gonna push your hand downward, okay? And making sure this is even nice. So the fulcrum is gonna be on the ulnar side process. I'm gonna shift this way a little bit so you can be on the edge. Is that okay?
Yeah.
Okay. Fulcrum is on the ulnar side process. Stationary arm is parallel to the floor. Actually, it's gonna be on the lateral aspect of the humerus. And then I'm gonna have the patient go ahead and pull your fingers downward, so you'll go into flexion here as much as you can. And the moving arm is along the fifth metatarsal. Can you go any more? Okay, I'm gonna apply a little bit of pressure. Okay, awesome. You can relax. So normal range of motion for wrist flexion is 80, and our patient is at about 72 with passive range of motion. Awesome. So we'll do the MMT. So first we will test your shoulder abduction. So you'll be taking your arm up to a 90 degree, and I'm going to apply some pressure, and you can just resist me, okay? Let me make this out of the way really quickly. Awesome. So for shoulder abduction, the main muscle that does this is the middle and posterior aspect of the deltoid, which attaches on the clavicle, 1/3 of the clavicle across to the acromion process. It inserts on the deltoid tuberosity. It does abduction as well as external rotation, and it is innervated by the axillary nerve. So I'm gonna have my resistance hand on the. Have you go here? My resistance hand is on the just proximal to the wrist, and my supporting hand is on the shoulder. I'm gonna have you push up against my hand right here. Push, push, push. 3, 2, 1. Awesome. You can relax. And then we will do elbow flexion. That muscle is the brachialis. The origin is the distal shaft of the humerus. It inserts on the halfway point of the ulna. It does elbow flexion, and it is innervated by the musculocutaneal nerve. So I'm gonna have you here. So I'm gonna place pressure here, and I'm gonna have my supporting hand on top of your shoulder, and you're just gonna try to. Is it on the left? Yeah, it is on the left. Thank you. I'm gonna have my resistance hand here, and I'm gonna place my supporting hand on your shoulder here, and you're gonna just try to pull your hands towards your shoulder, okay?
Keeping my elbow.
Yeah, you can flex your elbow. So you'll push here, push, as hard as you can. Awesome, and relax. Thank you. On the left side, and then on the right side, we're going to do extension, which is a grade 2 out of 5, so there's no resistance. That is the extensor carpi ulnaris radialis longus. The origin is the lateral epicondyle of the humerus. It inserts on the base of the second metacarpal. It does extension as well as radial deviation, and it is innervated by the radial nerve. And that's going to be the right side. Let's see. You okay? Okay, great. Cool. So I'm going to give you a little bit of support here. So we're going to do this gravity minimized. So you're going to place your right hand on here, and what you're going to do is you're going to have it thumb upwards, and then you're going to just pull your fingers back as much as you can, okay?
All right.
Okay, cool. So your elbow is nice and supported here, and as you can, just go ahead and pull your fingers back. Cool. Keep trying to keep the fingers straight and relaxing the shoulder. Nice. Okay, and relax. Thank you. Okay. Wonderful. So that is all we have today. Do you have any questions for me? No questions?
No questions.
Okay, awesome. So I'm going to have you go back to laying on your back here, and we'll wait for the physical therapist. If you have any questions, just let us know. So we'll go ahead and take off your shoes. And how is your wrist feeling any better or worse from anything that we did today?
Still the same.
Still the same? Okay, I'm going to scoot this fellow over this way, and you can lay down this way. Awesome. You can relax like a patient, not like your own. And yeah, if you need anything, just let us know, and the PT will be in shortly, okay?
Okay.
Thank you. Thank you so much.